Respected panelists, sir, are you there?
Yes, sir.
Namaskaram.
Please wait. I'll let you know when to start. Start ಆಗಿದೆಯಾ? ಸ್ವಸ್ಥೆ ಮನಸಿ ಜಾಗ್ರತ್ಯಾಂ ಬುದ್ಧಿರ್ಭವತಿ ನಿರ್ಮಲ. ನಿರ್ಮಲೆ ಬುದ್ಧಿ ತತ್ವೇ ತು ಜ್ಞಾನದೀಪ ಪ್ರಜಾಯತೆ. When the mind is refreshed and awakened, the intellect becomes clear, and in that clarity, the lamp of knowledge shines brightly. Now that we are recharged, let us awaken our minds with the same energy and enthusiasm for this Shastriya Samvada. Esteemed panelists, dear participants, and all the Ayurveda enthusiasts, I welcome you all for the post-lunch session. With that spirit, I invite our first participant, Rishita. Over to you, Rishita. You may now continue.
Namaskaram. My name is Rishita. I'm a student of Sadguru Gurukulam Isha Samskriti. Today I'll be presenting Danta Dhavanam, Nasyam and Tambula Seva. I'll be starting with Danta Dhavanam. Arkanyagro Khadira Karanja Kakubhadikam Pratar Bhuktva Chamridvagram Kashaya Katutiktakam Kaninyagra Samastaulyam Pragunam Dwadashangulam Bhakshaye Danta Pavanam Danta Mamsanyapadhayan. So after Shaucha Vidhi in the morning, next you should practice Danta Dhavanam. Dantani puyante shodhyante anena iti. Danta Dhavanam is the practice of brushing teeth. The materials used for Danta Dhavanam should be predominant of Katu, Tikta, Kashaya, Rasas like Arka, Nyagroda, Khadira, Karanja, Kakubha, Adi. Adi means Asana, Karavira, etc. The brush which are using for Danta Dhavanam should be Mridvagram, soft tipped by crushing. Kaninyagra Samastaulyam, the thickness of the brush should be as much as your pinky finger. Dwadashangulam, it should be Dwadasha of your angulas, etc. Now I'll be telling the contraindications of Nasya. नाद्यादजी नममथु श्वासकासज्वरार्दिति तृष्णास्यपाकहृन्नेत्रशिरः कर्णामयी च तत्. So these people who are suffering from these diseases should not practice Danta Dhavanam. There are few materials you can also use for Danta Dhavanam like Varga Tritiyam plus honey and Kushtam plus honey. There are few contraindicated drugs also like Nirgundi, Shleshmatakam, Arishtam, etc. You should not use the materials which have Swadvamla Lavana Rasas for Danta Dhavanam. Also Shushkam, dry twigs, Shushiram with holes, Putihi with Durgandha and Pichilam, slimy. Now I'll be continuing with Nasya. Benefits of Nasya. Anutailam tato nasyam tato gandusha dharanam ghanonata prasannatwak skanda grivasya vakshasa sugandhi vadana snigdha niswana vimalendriyaha nirvali palita vyanga bhave yurnasya shilina. So if you practice Nasya, the benefits are your shoulder neck region will be ghanam, it will be strong and straight. Your face will be without blemishes, and also vali, which is wrinkles, premature graying of hair also won't be there, etc. Now I'll be doing Tambula Seva. हन्वोर्बलं स्वरबलं वदनोपचयः परा स्यात्परं च रसज्ञानम् अन्ये च रुचिरुत्तमं न चस्य कण्ठशोषः स्यात् न ओष्ठो स्फुटनाद्भयं न दन्तानि क्षयं याति दृढमूला भवन्ति च. So if you practice Tambula Seva, your temporomandibular joint will be strong, and your sweet voice also, and your Vadana Upachayas, your oral cavities will be without any diseases. Contraindications of Tambula Seva: Tambulam kshatapittasya rukshot kupitachakshusam vishamurchamadartanam apathyam shoshvinamapi. So these people who are suffering from diseases like kshata, pittasra, ruksha, they should not practice Tambula Seva. Namaskar. You can ask questions.
Yeah, Samichinam. Rakta Prakopaka or Malashodaka?
I can't hear you clearly.
Tambula, whether it is a Rakta Prakopaka or it's a Malashodaka?
It's both.
It's both. Okay.
Yes.
You told Danta Davana.
Yes.
Yeah. In Danta Davana, prior to making a Davana, they told it's a
Your voice is
Kadayita.
breaking.
It's not hearing now?
Yeah, now it's fine.
In Danta Davana, before to do the Davana, they told it's a Bhakshayeta. Yeah, what is the meaning of the Bhakshayeta?
Brush.
No, what is the intention of making an Bhakshana?
Can you repeat the question once again?
What is the necessity to make the Bhakshana? You can do directly the brushing, na? Davana karna.
I didn't get your question.
When you have a brush, no need to make a Bhakshana. Why they told it's a Bhakshana karma first?
I don't know.
You got the question? You don't
No,
know.
I didn't get the question.
You didn't get the question. Okay. Before to doing the Davana karma, they told it's a Bhakshana.
I don't know the answer.
Bhakshaye Danta Pavana. You don't know the answer. Okay. And why only have to do the Danta Davana in the morning time?
You don't have to only do it in the morning. You're supposed to actually do it after every meal also.
After every meal also. Okay. But there is a contraindication is also there, na?
Yes.
But that is not there.
I didn't get your question. Yes.
No, in Ajina, it should not be performed, na?
Ajirnam tu kaphadanam tatra shoposhgandhayoh sadyo bhuktva ivodgara prashekotklesha
But after the
gaurav.
every meal, you told to do the Danta Davana. After the every meal, there is stagnantly a slight Ajina will be there. Itaha bhuktasya Ajina. What about that one? Whether it's indicated after every meal?
But Ajirna is a disease. If you have a disease only, you should not do it.
Okay. Pratha eva bhuktva they told, la, it's not in that in every time. It's only in the Pratha Kala eva.
Prata and bhuktva. So after eating also they said.
The bhuktva, they told it's for the mudvagram bhuktva. Like not with that after the every meal.
I didn't get it.
No, it's bhuktva. If you told means after every meal, if you said means it should say at after the once again in the after the ahara sevanam. Pratah mudvagram bhuktva. Kim bhuktva? Whether they told it's ahara?
After food.
No, where it is mentioned bhuktva means it's only ahara.
Bhuktva cha.
Bhuktva cha. Kim bhuktva cha?
Aharam.
Whether it is mentioned aharam cha. Before getting the snana, whether they told it's
But it's mentioned in the morning and bhuktva cha, and
yeah,
what you eat is food.
whether it is in morning food or it's in a hestana ratre
It's
bhakshita
after
ahara
every meal.
after every meal.
Cha means and. So, yeah, it's also after every meal.
Okay. One more point over tambula is there, na?
Yes.
Why not be indicated in the Visha Murcha Madarthana as it is in Apatya?
Because if you tambula makes the blood run quick, I mean it'll spread to your body. So if you have like visha or something, that will also like spread quickly.
It's a Astra Prakopaka, Rakta Prakopaka. That's why should not be given in these conditions. Okay. Yeah, nice. It is a Astra Prakopaka. Kshata Pittasra Rukshot Kupita Chakshusham. Kupita. Asra Kupita. In that condition, they should not be given it. So that's why in the Vishaya Murcha Madarthanam api.
Okay.
Yeah, okay. Thank you.
भवती उक्तवती भुक्त्वा च इति तत्र
Yes.
भुक्त्वा इत्यत्र कः प्रत्ययः?
I can't hear you clearly. Can you repeat it once again?
भुक्त्वा भुक्त्वा च in भुक्त्वा which pratyaya is there?
Kwatam.
Bhuktva, which pratyaya and which dhatu?
I don't know.
Okay. पुनरेकवारं श्लोकं श्रावयति.
Which one should I tell?
Any shloka.
अर्कन्यग्रोध खदिर करञ्जककुभादिकं प्रातर्भुक्त्वा च मृद्वग्रं कषाय कटुतिक्तकम्.
In pratar bhuktva, split this.
प्रातः भुक्त्वा.
In sandhi.
विसर्ग संधि. विसर्ग संधि.
विसर्गस्य सकारः वा विसर्गस्य रेपो वा विसर्गस्य लोपो वा किम् अस्ति तत्र?
रेपम्.
रेपम्. अरे अस्तु, धन्यवादः.
Dhanyawada, Rishita. Now we'll move on to the next participant, Shailaja V. Shailaja, yes, you may now continue.
Namaskaram. My name is Shailaja. I'm from Sadhguru Gurukulam Samskriti. Today I'll be presenting a part of Dinacharya, which is about Anjana and Dhumapana. Anjana is collyrium or kajal. There are two types of Anjana. One is Sauviranjana, other is Rasanjana. First, I'll be explaining about Sauviranjana. The benefits of Sauviranjanam are Sauviramanjanam Nityam Hitam Akshnostato Bhajet. Sauviranjanam is pleasing to the eyes and hence can be used daily. The matra for Sauviranjanam is Trishalaka. लोचनेतेन भवतः सुस्निग्धगणपक्ष्मणि व्यक्तत्रिवर्णे विमले मनोज्ञे सूक्ष्मदर्शने. With the use of Sauviranjana, the eyelashes will become thick and unctuous. The eyes will be predominant of the three colors, black, white and red in the appropriate areas. The eyes will become beautiful, clean and with sharp vision. Rasanjana and its benefits. चक्षुस्तेजोमयं तस्य विशेषात् श्लेष्मतो भयं योजयेत् सप्तरात्रेस्मात् श्रावणार्थे रसाञ्जनम्. Since the eyes are predominant of Agni Mahabhuta, there is a special fear towards diseases of Kapha dosha. Because of this, Rasanjana, another type of collyrium with more purificatory factors, is used once in a week to expel excess Kapha. The matra for Rasanjanam is Harenu matra. There are two ways of making Rasanjana. One is Sauviranjana with Darvikvatham, other is Darvikvatham with Ajakshiram. According to Charakacharya, the time to use Rasanjana is at night. Rasanjana can be used once in Pancharatri, Saptaratri or Ashtaratri. The contraindications for Rasanjana is Jwaritaha, Charditaha, Shrantaha, Bhuktaha, Shirasnataha and after this Tato Navana Gandosha Dhuma Tambula Bhag Bhavet. After Anjana, Nasya, Gandusha, Dhumapana and Tambula Seva should be followed in this order. And I will now tell about Dhumapana. The benefits of Dhumapana are Prayogikam Tatto Dhumam Gandhamalyadi Chacharet Dhumasya Udvajatrutha Na Syurvata Kaphamaya. After Gandusha, you should practice Dhumapana. There will be no disease, Vata Pitta Kapha disease above Jatru if you practice Dhumapana. Namaskaram.
अस्तु समीचीनमेन उक्तः कदा अञ्जनं न करणीयमिति
Can you speak in English?
when not to perform anjana karma
When you're contraindicated, which is Jwaritaha, Shrantaha, Charditaha, Shirasnataha, Bhuktaha, Ratrau Jagirataha.
why
Because in most of these activities you will already be tired and Rasanjana will make you more tired.
And one more they told Sauvira Anjana for the Ratro Seveta. So which Anjana is told in the Ratri Kala?
Rasanjana.
Why in the Ratri Kala only?
Because you'll be resting at that time, and Rasanjana expels kapha from your eyes, so that will make your eyes tired. Vireka durbala drishti adityam prapyam sidati.
Sidati. Yes, correct. Yeah, thank you.
धूमपानस्य प्रयोजनं तत् श्लोकं वदतु।
प्रायोगिकं ततो धूमं गन्धमाल्यादिचाचरेत् धूमस्य उद्वजतृतः न स्युर्वातकफामय.
Which kriyapada is there in this shloka?
आचरेत्.
Acharet. Which lakara? Acharet.
लिङ् लकारः.
लिंग लकार। विधिलिंग वा आशीर्लिंग वा?
विधिलिङ्.
विधिलिंग आचरेत्। स्युः इति अस्ति तत्र।
Can you repeat?
स्युः इति in that shloka. Kriyapada स्युः. Which dhatu
Yes.
is that? स्युः.
स्यात्.
हाँ, स्यात् स्यातां स्युः। Which धातु?
अस्ति.
अस् धातु। हाँ, अस् धातु in which lakara is स्युः?
I don't know.
It's in lang lakara.
Okay.
Okay.
Judges, do you have any other questions?
Yeah, no.
Dhanyawad, Shailaji. Now we move on to the next participant, Siddharth. Yes.
Namaskaram. Today I'll be presenting about Dinacharya and one of the main charyas in Dinacharya, which is Abhyangam. And I'll be trying to present in Sanskrit. दीर्घजीवितम् आरोग्यं धर्मम् अर्थं सुखं यशः इत्यादीनां लब्ध्यर्थनार्थं कृतस्य आयुर्वेदतन्त्रस्य प्रयोजनमध्ये प्रथमस्थानमेव स्वस्थस्य स्वास्थ्यलक्षणं। वाग्भटाचार्य एतादीनां प्राप्त्यनार्थं तथा च धर्मार्थकाममोक्षपरिग्रहार्थं दिनचर्यारूपेण आरोग्यकराः आचाराः विवरणं कृतम्। दिनचर्या तु दिने दिने चर्या दिनचर्या दिनस्य वाचर्या दिनचर्या चरणं चर्या उभयलोकहितम् आहारविहारचेष्टितमिति यावत् प्रतिदिने यत् कर्तव्यम्। तत्र नस्य अञ्जनताम्बूलादिसेवानन्तरं विचारणरूपेण स्नेहनादीन् प्रयोगम् अभ्यङ्गं रूपेण करणीयम्। अभ्यङ्गमाचरेत् नित्यं सजराश्रमवातः दृष्टिप्रसादपुष्ट्यायु सुस्वप्नत्वक्त्वदार्ढ्यकृत् अभ्यङ्गं तु नित्यं सततम् आचरेत् स च उत्पन्नायां क्षुधि एव विधेयः सोऽभ्यङ्गो आचार्यमाने ज्वरश्रमश्च वातश्च हन्ति। दृष्टिप्रसादवैर्मल्यं निर्मलनिर्मलीत्वक्त्वं त्वच्यश्च करोति। एवमेव चरकसंहितायामपि तस्याशीत्यध्याये अपि उक्तम्। स्पर्शनभ्यधिगो वायु स्पर्शनं च त्वगाश्रितं त्वच्चश्च परमभ्यङ्गं तस्मात् तं शीलयेत् नरः शिरश्रवणपादेषु तं विशेषेण शीलयेत् तस्मात् तम् अभ्यङ्गं सर्वेषु अङ्गेषु अभ्यासात् विशेषेण मूर्धकर्णाङ्घ्रिषु. सो शिरोभ्यङ्गगुणानि तस्याशीति अध्याये चरकसंहितायां तस्याशीति अध्याये अपि उक्तम्. नित्यं स्नेहाद्रिशिरस शिरशूलं न जायते न खालित्यं न फालित्यं न केशा प्रपतन्ति च बलशिरकपालानां विशेषेणाभिवर्धते दृढमूलाश्च दीर्घाश्च कृष्णकेशा भवन्ति च इन्द्रियाणि प्रसीदन्ति सुत्वग्भवति चाननं निद्रालाभः सुखं च स्यान्मूर्ध्नि तैलनिषेवनात् कर्णाभ्यङ्गेन तु न कर्णरोग वाथोत न मन्याहनुसङ्ग्रह नो च श्रुतिर्न बाधिर्यं स्यात् नित्यं कर्णपूरणम्. पादाभ्यङ्गगुणानि तु खरत्वं स्तब्धतारोक्षं श्रमः सुप्तिश्च जायते मध्य एवोपशाम्यन्ति पादाभ्यङ्गनिषेवनात् जायते सौकुमार्यं बलं स्थैर्यं च पादयोः दृष्टिप्रसादं लभते मारुतश्च उपशाम्यन्ति न च स्याद्घृद्रसीवात पादयोः स्फुटनं न च न शिरस्नायुसङ्कोच पादाभ्यङ्गं पादयोः. एतादीन् अभ्यासात् एतादीन् गुणान् पादाभ्यङ्गम् अभ्यासात् प्राप्यते. किन्तु वर्जोभ्यङ्गकफग्रस्त कृतसंशुद्ध्यजीर्णिभिः कफग्रस्त वमनविरेचनानन्तरम् अजीर्णरोगी अभ्यङ्गं वर्जनीयम्. नमस्कार.
अभ्यङ्गं वर्जनीयम् इति उक्तवती. वर्जनीयम् इत्यत्र प्रत्ययः.
Can you speak in English?
Varjaniyam. In this word, which pratyaya is there?
I don't know.
Okay. That shloka once again.
वर्जोभ्यङ्गकफग्रस्त कृतसंशुद्ध्यजीर्णिभिः.
Next pada.
That's it. लाघवं कर्म सामर्थ्यं दीप्तोऽग्निर्मेधसक्षयः विभक्तघनगात्रत्वं व्यायामातुपजायते.
Do paracheda of this shloka.
लाघवं कर्म सामर्थ्यं दीप्तः अग्निः मेधसः क्षयः विभक्त घनं गात्रत्वं व्यायामात् उपजायते.
Vyayamat upajayate.
व्यायामात्
Which vibhakti in Vyayamat?
पंचमी.
Upajayate. This which upsarga?
उप
Dhatu.
च
Upajayate. Jayate is in which padi? Parsmepadi or Atmanepadi?
आत्मने.
Atmanepadi is Prathama Purusha or Madhyama Purusha? In which Purusha is?
प्रथम पुरुष.
प्रथमपुरुष बहुवचनं वा?
I'm not जाने.
अस्तु, धन्यवादः।
अत्र शिरश्रवणपादेषु तं विशेषेण शीलयेत्। अत्र क्रियापद किमस्ति? का क्रियापद?
शीलयेत्.
शीलयेत्। अर्थः किं भवति? शीलयेत् इति?
You should do. Especially if not possible everywhere, you must do at least in Shirashravana Padesh.
शीलयेत्।
You should practice.
किमर्थं शिरश्रवणपादेषु एव?
It'll reduce vata.
Reduce the vata. In other sharira also can do, na? There also it will reduce the vata, as it's called jarashrama vata. Why only in this specific area?
Those places are pangu.
Pangu? How?
That's vata sthanam.
Which vata? No, which vata sthana these are?
Which vata?
You told these are the vata sthana.
Pranam. Prana.
In pada it's not there, na? Prana vata.
Apana.
Prana vata will be there. Sarvadeha chari. They told because of the abhyanga, drishti prasada. How can you assess that drishti prasada? In which way?
द्वेपाद मध्ये पृथुसन्निवेशे शिरे गते ते बहुधा च नेत्रे ताम ऋक्ष्णोद्वर्तन लेपनादीन.
Which abhyanga that is? Then it should be pada abhyanga.
पाद प्रयुक्ता नयने नयन्ति.
अस्तु, समीचीनम्. इतोपि प्रश्नः नास्ति. धन्यवादः.
Dhanyavadah. May I now bring to the notice to judges that now we will be having presentations from Doshadi Vijnana. Now we will move on to the next participants, Advaita. Over to you.
Namaskaram. My name is Advaita. I'll be presenting Doshadi Vijnaniyam, and then I'll be presenting the formation of dhatus, ojas, and summary of the chapter. Swasthanasthasya kayagne ramsha dhatushu samshrita tesham sadati diptibhyam dhatu vriddhi kshayodbhava purvo dhatuv param kuryat vriddha kshinascha tadvidham. There's a Kaya Agni, which is the digestive fire. It is located in all the dhatus, and if that decreases, the dhatu will increase, and if the Kaya Agni increases, the dhatu will decrease. If the previous dhatu gets imbalanced, the same thing will happen to the succeeding dhatu. Dosha dushta rasai dhatun dushayantyubhaye malan adho dve sapta shirasi khani sveda vahani cha mala malayanani syur yatha swamteshvato gada. If you have the wrong kind of taste, the doshas will get imbalanced, and the doshas will imbalance the dhatus. The doshas and dhatus will imbalance the malas. The malas will spread diseases to the malayanas, which are 2 in the bottom, 7 in the face, and the skin pores. ओजस्तुतेजो धातूनां शुक्रान्तानां परं स्मृतं हृदयस्थमपि व्यापि देहस्थितिनिबन्धनं स्निग्धं सोमात्मकं शुद्धं मीशल्लोहितपीतकं यन्नाशे नियतं नाशो यस्मिन् तिष्ठति तिष्ठति निष्पद्यन्ते यतो भा विविधा देहसंश्रया. Ojas is the essence of all the dhatus, which comes after Shukra. It is located in the heart, but it's all over the body and it maintains the body. Its qualities are oiliness and cool. It's pure but slightly reddish and yellow. If the ojas gets destroyed, then the full body gets destroyed. But if it stays, the body also stays. Every aspect of the body has ojas. ओजक्षीयेत कोपक्षुध्यानशोकश्रमादिभिः बिभेति दुर्बलो भीक्ष्णं ध्यायति व्यथितेन्द्रिय दुश्चायो दुर्मनारूक्षो भवेत् क्षामश्च तत्क्षये जीवनीयौषधक्षीर रसाद्यास्तत्र भेषजम्. ओजो वृद्धौ हि देहस्य तुष्टिपुष्टिबलोदय. What causes ojas to decrease is anger, hunger, constant thinking, grief, exhaustion. If ojas decreases, there will be phobias, weakness, constant thinking, sensory disturbances, loss of complexion, confusion, dryness, and exhaustion. The medicines to increase ojas is things which nourish the body, like milk and meat soup. If ojas increases, there will be tushti, pushti and bala, which is happiness, nourishment and strength. Yadannam dveshti yadapi pratayeta virodhitu tattatyajan samashnamscha tautau vriddhikshayo jayet kurvatehi ruchim dosha viparita samanayo vriddhaksheenascha bhuyishtam lakshayantya budhanatat. Vriddhi and Kshaya of the doshas are to be treated by not having the food which you don't like and having the food which you like, but it shouldn't be contraindicated. If the doshas are increased, the body will crave for the opposite things, and if it decrease, the body will crave for the similar things. But the people who are abuddha or not knowledgeable will not be able to observe what their body is asking for. यथा बलं यथा स्वं च दोषा वृद्धा वितन्वते रूपाणि जहति क्षीणा sama swam karma kurvate. If it's increased, the gunas will increase, and if it's decreased, the gunas will decrease. If it's in the normal state, they will do what they need to do. Ya eva dehasya samavivridyai ta eva dosha vishamavadhaya yasmadataste hitacharyayaiva kshayadvivriddheriva rakshaniya. The doshas, when balanced, save the body, but when imbalanced, can destroy the body. So by maintaining it, to maintain it, you should follow a good lifestyle. Namaskara. I'm done with my presentation.
Yeah, astu. पूर्वो धातु परम कुर्यात् वृद्धक्षीणस्य तद्विधम्. What actual meaning of this one?
It means if the previous dhatu, like for example, the previous dhatu increases, the same thing will happen to the next dhatu. And if it decreases, the same thing will happen to the next one.
Mm-hmm. What do you mean by the Malayanani? Malayanani syur yatha sum teshvato gadaha.
It means when the malas get imbalanced, it'll spread diseases.
In this line, what do you mean by the Malayanani?
There are two of the there are 2 at the bottom, and 7 the face, which are the eyes, nose, ears, and mouth, and the skin pores.
No, I am asking, what do you mean by the Malayanani? Which all the Malayanani I never asked.
From where the malas come out. The parts from where the malas come out.
They are the path.
Yeah.
Yes. Okay. You told Ojaha Shukrantanam. What actual meaning of the Shukrantanam Param?
It comes after the Shukra.
So is it the meaning of the after the Shukra, or it is in a all the end of the dhatu? It is in a Tejo. Tejo dhatu nam.
It
Dhatu nam Tejo.
it comes after all the dhatus.
It's all the dhatu. They told it's Hrudayastamapi Vyapi. Dehasthiti Nibandanam. What the meaning?
It's located in the heart, but it's like spreads all over the body. It's mainly in the heart.
Yennasho niyatam nasho yasmin tishtati tishtati. Which one is making the tishtati tishtati?
Tishtati means if the urge stays, the full body stays.
Oh, just stays means the body will stay.
Yeah.
Not making in a coincident of the same meaning. Yennasho niyatam nasho yasmin tishtati tishtati.
It means
Whether it is related to Deha or other than the Deha.
Could you repeat it?
They told it is a tishtati tishtati. Yennasho niyatam nasho. Whether it is related to the Deha only, that other than the Deha.
Everything. I mean, like if everything will get.
Everything means which one? Which all every?
Everything will get destroyed. I mean, if there's no urges, then the body won't exist. Everything will get
Dehasthiti
destroyed.
Nibandhana, those only. Not Deha. Dehasthiti, Deha Nibandhana, those. Tishtati tishtati.
The mind, body, everything will get destroyed.
You told Biveti Durbalo Bhikshtam Dhayati Vititendriyaha Duchayo Durmana Ruksho Bhavekshama Shatakshaye. So Ojakshaya happens means all the Lakshanas are told, it's a Sharirika Samadha Manasika. Why Manas is involved in the Ojakshaya? Biveti Durbala Abhikshnam Dhyayati.
Everything, mind and the body. I mean, they.
What do you mean by the Duchaya? Duchayo Durmana.
Duchaya means the complexion or the aura will reduce, and Durmana means confusion.
Mana is not in the proper condition. Durmana.
Yeah.
You told it's a Vojo Ruddhohi Dehasya Tushti Pushti Balodayaha. Here Tushti Pushti means which Tushti, which Pushti?
Tushti is happiness, Pushti is nourishment, and Bala is strength.
Kasya Tushti, Kasya Pushti?
What? Can you repeat?
Kasya Tushti, Kasya Pushti Karoti?
Minds.
You told previously it's a Deha.
For Tushti, it's the mind, and Pushti is the body. So the happiness will in the mind and nourishment for the body.
And lastly you told, na? एव देहस्य समाविरुद्धै त एव दोषा विषमावधाय यस्मादतस्ते हितचर्यैव. Say once again, it's which one is the Kriya Pada in this one, Shloka?
Can you repeat the question?
In this Shloka, eva dehasya samaviruddhai ta eva dosha vishmavadaya. Which one is the Kriya Pada?
Vadhaya and Rakshaniya.
Vadhaya and Rakshaniya. Yeah. Yes. Mine is done.
Ramachandra sir, do you have any-
Pratyaya in Rakshaniya. Which Pratyaya? Rakshaniya.
Your voice, can you repeat it?
Vad. In
I don't know.
Rakshaniya. Okay. Vadhaya. Total Vadhaya, right?
I don't know.
Kriyapada. No, Kriyapada. Which Kriyapada are there in Shloka?
I don't know.
Recite once again, Shloka.
य एव देहस्य समाविवृद्ध्यै त एव दोषा विषमावधाय यस्मादतस्ते हितचर्ययैव क्षयादिवृद्धेरिव रक्षणीयाः.
Vadhaya. There is the Kriyapada. Vadhaya. Vadhaya is Kriyapada.
I don't know.
Do Parachada of this Shloka.
य एव देहस्य समाविवृद्ध्यै त एव
Dehasya. Wait. Dehasya. Which vibhakti? Dehasya.
षष्ठी विभक्ति.
Just vibhakti. Next. Do Parachada.
Sir, any other
Can you-
questions?
श्रूयते वा मोहम्मद खलील?
आं महोदय श्रूयते.
परच्छेदं करोतु. अस्य श्लोकस्य परच्छेदम्.
य एव देहस्य समाविवृद्ध्यै त एव दोषा विषमावधाय यस्माद् तत् अदत्ते हितचर्ययैव एव क्षयाद् वृद्धे रिव क्षया वृद्धे इव रक्षणीया.
यस्मात्. Which विभक्ति?
पंचविभक्ति.
पंचमी.
पंचमी विभक्ति.
अस्तु, धन्यवादः.
Dhanyawada.
अस्तु, धन्यवादः.
Now we move on to the next participant, Anahata.
Namaskaram. My name is Anahata. I will be presenting 11th chapter Doshadi Vijnaniyam. I will present Kshaya Lakshana of doshas, dhatus and malas. Lingam Shineni Lingasya Sadolpam Bhashite Hitam संज्ञानाशस्तथा श्लेष्म वृद्युक्तामय संभव पित्ते मन्दो नलः शीतं प्रवाहानि खपे भ्रम श्लेष्माशयानां शून्यत्वं हृद्रवश्लथसन्दिता. The symptoms of decreased vata are the body, there be weakness in the body. They'll speak less and their movements will be less. They lose consciousness and the symptoms of decreased kapha. The symptoms of decreased pitta are the digestion will be weak, they'll feel cold and their aura will go. The symptoms of decreased kapha are they'll feel dizzy, the limbs will be loose, the throat, the places wherever kapha is in your body, there it'll feel empty. Your heart will beat fast. Rase rauksham shrama shosho glani shabda sahishnata mamse kshaglani gandaspik shushkatha sandivedana मेदसी स्वपनं कट्याः प्लीह्नो वृद्धि कृशाङ्गता अस्न्यस्तितो दशदनं दन्तकेशनखादिषु अस्त्रमज्जनि सौशील्यं भ्रमस्तिमिरदर्शनं शुक्रे चिरात् प्रसीच्येत शुक्रं शोणितमेव वा. The symptoms of decreased rasa are there'll be dryness in your body, they'll feel tired, their limbs will be skinny, without doing any activity they'll feel tired and they'll be intolerable towards sound. The symptoms of decreased medas are there'll be numbness along your hips, your spleen will get swollen, their limbs will be skin, it will become thin. The symptoms of decreased medas is the symptoms of decreased asti are there'll be shooting pain in your bones. Your hair, teeth, and nails will fall. The symptoms of decreased majja are they'll have osteoporosis, they'll feel dizzy, there'll be dimness in their eyes. The symptoms of decreased shukra are the shukra will come out slowly or it'll come out with blood. The genital organ will pain and burn. पुरीशेवायुरन्त्राणि सशब्दो वेष्टयन्निव कुक्षौ भ्रमति यात्यूर्ध्वं हृत्पार्श्वे पीडयन् वृषं मूत्रेऽल्पं मूत्रयेत् कृच्छ्रात् द्विवर्णं सहस्रमेव वा स्वेदे रोमच्युतिस्तब्धा रोमता स्फुटनं त्वच मलानामतिसूक्ष्मानां दुर्लक्ष्यं लक्षयेत् क्षयं स्वमलायन संशोष तोदशून्यत्वलाघवे. The symptoms of decreased purisha are gas will be in your intestines. If they'll feel like their intestine is twisting. In the stomach, air will go around and will move up towards the heart and cause extreme pain. The symptoms for decreased mutra are while passing out the urine, it will be discolored or it will come out with blood. This decreased sweda causes the skin hair
सर्वक्षय कृते भवति वदन्नस्ति खलु.
Anna, can you speak in English?
You are saying about all the kshayas, na? Dosha, dhatu, mala.
Yes.
Yeah. Kshaya actual meaning is whether it is reduction in quantity or quality.
Both.
Both. Yeah, sure. He told it's a lingam kshine anile angasya sadho alpam bhashite hitam. Explain this line.
Lingam means symptoms. Kshine means decreased. Anila means vata. Your limbs will feel weak. Your speech and movements will be less.
Can you make the pada vibhaga for that shloka?
Lingam kshine anile angasya sadho alpa bhashite ihitam.
Ahitam or ihitam or hitam?
Ihitam.
Ihitam. What is the kriya pada in this one?
Kshine.
Kshine means in the kshina, in that will artha, but it is not in the kriya pada, na?
Sambhava.
क्षीणे भवति सम्भवाति तदपि चलति पुनः अत्र एकः अस्ति खलु रसे रौक्षं शमशोषो ग्लानिः शब्दासहिष्णुता what its meaning
Rase means decreased rasa. There be dryness in the body. Yeah, therefore, shrama means tiredness. Shosha means emaciation. Glani means weakness. Shabdasahishnata means intolerable towards sound.
intolerable to sounds or hearing
Sounds.
no whether it's a hearing or seeing
Hearing.
hearing only अस्तु मया तु अभवत् धन्यवादः
अस्तु ममापि प्रश्नाः न सन्ति अग्रे गच्छामि
धन्यवादः
धन्यवादः
धन्यवादः अनाथ. Now we move on to the next participant, Anvi K.
Namaskaram. My name is Anvi. I am from Sadguru Gurukulam Samskriti. I will be presenting Sutrasthana Ashtangarhidayam, 11th chapter, Doshadi Vijnaniyam, the treatment part. तत्र स्थनिस्थितो वायुः पित्तं तु स्वेदरक्तयो श्लेष्मा शेषेषु तेनेषाम् आशे आशेनामितः. This means that there are relations within doshas, dhatus and malas. Vata and asti are related. Pitta, rakta and sweda are related. Shleshma and the other dhatus and malas are related. Yade kasya tadanyasya vardhanashapanaushadam. That means that if you give medicine for one dosha dhatu or mala to increase, the other also will increase the ashaya of it. अस्ति मारुतयोर्नैवं प्रायो वृद्धिर्हि तर्पणात् श्लेष्मानानुगता तस्मात् संशयतत् विपर्ययात् वायुनानुगतोऽस्मात् च विद्धिक्षयसमुद्भवान् विकारान् साधयेत् शीघ्रं क्रमालङ्गाणब्रह्मणै वायु अन्यत्र तज्जांस्तु तेरै उत्कम Yojite. It means as for Asti and Vayu, it's different. It's not the same. And if something is increased, it's usually because nourishment is there. And Shleshma is involved in it. For decrease, it's that Vayu's invalidate because there's less nourishment. If you want to treat it, then you have to use Langana and Brahmane, which is if it is increased, then you have to use Langana, and if it is decreased, for Vata, it's not like that. It's the same method but opposite. Vishesha Rakta Vridyuktan Rakta Struti Virechane. That means, particularly for Rakta, when it's increased, you have to let the blood come out, and you have to make them go for loose motion. Mamsam Vriddhim Bhavan Rogan Shatstrukshara Agni Karmabhi, which means that when mamsa is increased, you have to cut out the extra flesh, or you have to give them a powder which will cause irritation there and make it come out, or you have to do heat therapy. Shaurya Kashya Upacharena Staulya Kashya Upacharena Medojan. That means treatment for increased and decreased medas. It is mentioned in the 14th chapter. Astik Samshaya Asti Samshaya Jatan Kshira Drite Raktas Samyur Yute Ravas. Okay, I'll tell the meaning. It means that when asti is decreased, you should give them like the goat meat and the sheep meat from middle of the body, and if that is only if they're non-vegetarian. If they're vegetarian, you should give them a porridge which is made out of black grams and etc. Can I tell the meaning alone?
Yeah.
So if oh my, sorry, the before one which I told is for decreased fecal matter, but now I tell asti. So for asti, you should give milk and ghee mixed with bitter herbs. For mutra, if it's increased or decreased, you have to follow different kind of method which is used for diabetes and like holding of the urine. So that is mentioned in the Samada chapter. When Swedas decreased, you have to make them do abhyangam, which is oil massage, or make them do exercises. Namaskaram.
Astu.
Can you
You told
speak in English?
Tatra.
Anna, can you please speak in English?
Yeah. You told Tatrastani Stito Vayu Pittam Tasveda Raktayo. You started from there, na?
Yeah.
Tatra Astani Stito Vayu. They told only Asti or Sampurna Sharira?
The whole body, but especially asti.
In Asti. Okay. There is a Shleshmana Anugata is there. Anugata meaning
is like going.
going means along with which?
With prana will increase. Sorry. If shleshma is increased, you become fat. So, yeah.
Okay. Vikaran sadhaye shikram kramat langana brahmanehi. Explain this one with Padavibhaga.
Okay. Vikaran sadhaye means you should treat. Chigram is immediately. Kramat means like increase, decrease, and yeah, like as
Langana
like
brahmanehi.
yeah, as giving light and heavy stuff, medicines.
Which one is a Kriyapada?
Sadayed.
Sadhayet.
Sadayet.
Astu. Mine is done.
तत्रास्तीषु स्थितो वायुः पित्तं तु स्वेदर्कयोः. That
Anna,
shloka.
Anna, your voice is not clear. Can you repeat the question again?
तत्रास्तीषु स्थितो वायुः. In that shloka, tatra is Avya Kriyapada.
Can you
or
repeat
Upsarga.
Anna, can you repeat the last few words alone?
तत्रास्तीषु स्थितो वायुः. In that shloka, tatra
Means
is
that.
tatra is
Means that.
Upasarga or Avya. Do Parachira of that
Avel.
shloka first.
Avel.
Avya. Right. So Paracheda.
Okay. Tatra means there.
Okay.
Tatra means there. Asti means. Astani means in Asti. Vayu stands.
Astishu, right?
Astan. It's Astani.
Astani. Tatrasthini. Next. Pitha.
Pittam. Pittam is pitta.
Which karanta pittam?
What?
Pittam shabda. Akaranto va. Ikaranto va. Which linga?
Akaranta.
Akaranta. Which linga is the Pullinga or Strilinga or Napumsakalinga?
Pitta is Pumlinga and Pittam is Napusakalinga.
Pittam shabda. Okay. Pittam Napumsakalinga shabda saha. Next. Sveda Raktayoho.
Sweda is sweat and Raktayoho is Rakta Dhatu.
Sveda Raktayoho. There is Ekvachana or Bahuvachana?
Dvivachana.
Very good. Dvivachana. Shesheshu.
like rest all.
Okay, Shesheshu, which vibhakti that?
Sapta vibhakti.
Saptami.
That what? Can you repeat the question, Anna?
Shesheshu, which vibhakti is?
Saptami vibhakti.
Saptami vibhakti. Saptami vibhakti ekavachanam.
Bahuvachanam.
Bahuvachanam. Very. Tena.
Te. Anna again.
Tena iti shabdah.
Tritiya. Ekavachanam.
Which shabda?
Strilingaha.
Which shabda? Tena.
Pumlingaha.
Pullinga. Shabdah ka?
I don't know, Anna.
Sahatautet. Netva. Sahatautetam tautan tena tabhyam.
Aham na janami.
Sarvanama. Okay. Tat shabda. Okay. Mithaha. In that shloka, there is mithaha word, right? Mithaha is what, kriyapada or upasarga?
Kriyapada. Anna.
Yenesham ashrayam mithaha. Last word, mithaha.
You want me to tell, Anna, you want me to tell the Shabdaha, which Vachanam then?
No. Which, that is kriyapada or upasarga?
Kriyapadam.
Mithaha is kriyapadam or upasarga or avyaya. Which is that?
Aham na janami.
Mithaha is the avyaya. धन्यवाद.
Thank you very much, Anvi. Now we move to the next participant, Atulya Ravindra.
Namaskaram. My name is Atulya. I'm going to present the 11th chapter, Doshadi Vijnaniyam Adhyayam from Ashtanga Hridayam Sutrasthana. Lingam Kshine Nilengasya Sadolpam Bhashite Hitam Samnya Nashasthata Shleshma Vridyuktamaya Sambhava Pitte Mando Nalashitam Prabhahani Kaphe Brahma Shleshma Shayanam Shunyatvam Ridrava Shlatasandita Rase Rauksham Shrama Shosho Glani Shabda Sahishnata Raktem Lashishira Priti Sira Shaithilya Rukshata मांसे क्षग्लानि गण्डस्पिक् शुष्कता सन्धिवेदना मेधसि स्वपनं कट्याः प्लीह्नो वृद्धिं कृशाङ्गता हस्त्यस्थितो दशदनं दन्तकेशनखदिषु हस्त्नमज्जनि सौशीर्यं भ्रमस्तिमिरदर्शनं शुक्रे चिरात् प्रसिच्येत शुक्रं शोणितमेव वा तोदोत्यर्थं ऋषणयोर्मेढ्यं धूमायतीव च पुरीशेवायुरन्त्राणि सशब्दो वेष्टयन्निव कुक्षौ भ्रमति यार्त्योद्वं हृत्पार्श्वे पीडयन् वृषं मूत्रेऽल्पं मूत्रयेत् कृच्छ्राद्विवर्णं स्वाश्रमेव वा स्वेदे रोमच्युतिस्तब्धरौमता स्फुटनं त्वचा assenting. The symptoms for decreased vata are your limbs will become weak, your speech and body movements will become less, and your loss of consciousness and diseases mentioned under increased kapha. Meaning meanings for the decreased pitta are weak digestion, you'll feel cold, and loss of aura. Decreased kapha, you'll feel dizzy. Wherever shleshmas in your body, it will feel empty, and your palpitation.
You are saying all the Kshaya Lakshanayukta doshas.
Yes.
Yeah, okay. There is one is there, like a pitte bandhu analaha sheetam prabhahanihi. What do you mean by the prabhahanihi?
Loss of aura. You look dull.
You look dull. Even in the Shrama also will look dull. What actual meaning of the prabhahanihi?
Can you repeat?
In Pitta Kshaya, they told it's a prabhahanihi.
Yes.
What the meaning of the prabhahanihi?
Loss
Whether
of
it is a
aura.
sharira. Whether it is a prabha related to alalaha or sharira prabha.
I don't know.
Okay. Shleshmashayanam shunyatvam means what?
Wherever shleshmas in your body, like head, chest region, joints, it'll feel empty.
Emptiness. Shlata sandhita means? Shlata?
Laxity of joints.
Elasticity of the joints. Okay. In Raktakshaya, you told it's Amla Shishira Priti Shira Shaitilya Rukshataha.
Yeah.
Make the Pada Vibhaga and find out which is the Kriya Pada.
Can you repeat?
Raktakshaya is there, na? Rakte Amla Shishira Priti Shira Shaitilya Rukshataha. Make a Pada Vibhaga and find out the Kriya Pada.
Rakte Amla Shishira Priti Sira Shaithilya Rukshata.
It's a single word, na? Amla Shishira Priti Shira Shaitilya Rukshataha.
Can you repeat?
It is in a single word or you are splitting all?
Splitting.
Splitting, okay. Which is the Kriya Pada in this?
Can you repeat?
In this line, which one is the Kriya Pada?
Preeti.
Preeti is a Kriya Pada.
I don't know.
You don't know. You told Purishe Vayurantrani Sashapto Vestriyaniva Kuksho Bravati Aturtum Hrut Parshve Pidayan Brusham. Pidayan meaning means what? Brusham Pidayan.
You'll feel pain. You'll have so much pain in the stomach area.
You can use the shula, na? Shulayan Brusham.
In the stomach and the sides of your abdomen.
What actual meaning of the Pidayan?
Suffering. Suffering.
Suffering. It is a type of a shula, na? Pidayan. Okay, let it be there. Yeah, mine is done. Okay. Dhanyavadaha.
ధన్యవాదాः.
Ramachandra, sir, do you have any questions?
No, thanks. No questions. Okay. Agree, Gacha.
Dhanyavadaha. Agre gacchatu.
ధన్యవాదాలు.
Thank you, Atulya. The next participant is Bharat Kumar.
Namaskaram. My name is Bharat. Today I'll be presenting the Prakrita Avasthas and Vriddha Lakshanas of Doshadi Vijnaniyam. Atato Doshadi Vijnaniyam Adhyayam Vyakhyāsyāma Iti Hasmāhuratrayadayo Maharshaya. As described by Maharishi Atreya and others, hence is described the Doshadi Vijnaniyam chapter. Doshadhatu malamulam sada dehasya. The doshas, dhatus and malas are the material cause of the human body. Tam chala utsahochvasa nishvasa cheshta vega pravartane samyak gatya cha dhatunam akshanam patavena cha anugrinnatya vikrita. Vata in undisturbed state gives utsaha, enthusiasm, uchvasa, exhalation, nishvasa, inhalation, cheshta, motor activities of the human body, vega pravartane, regulations of the 14 vegas, samyak gatya cha dhatunam, the regulations and functions of the dhatus, akshanam patavena cha, the regulations and the functions of the sense organs, anugrinnatya vikrita means vata gives this. It gives this. Pittam pakyushpadarshane kshutriruchiprabhamedha dhisho ritanumadavai sleshva stiratva snigdatva sandhi bandhakshamadibi. This means pitta in its undisturbed state gives pakti or digestion, ushma or body heat, darshana vision, shut hunger, trit
thirst, ruchi taste, prabha aura, medha intelligence, dhi perception, shaurya strength, and tanumardavahi, which means the soft body. Shleshma in its undisturbed state gives stiratva stability, snigdatva unctuousness, Chandibandha binding together the joints, Shama forbearance, Preenanam Jeevanam Lepa Sneho Dharana Purane Garbhodpadascha Dhatunam Shreshtam Karma Kramat Kritam. Rasa Dhatu in its undisturbed state is nourishing. Jeevanam means enlivening. This is the primary function of Rakta Dhatu. Lepa means overlay. This is the primary function of Mamsa Dhatu. Sneho, which means unctuousness again, is the primary function of Medo Dhatu. Dharana, which is to hold, is the primary function of Asti Dhatu. Purane, which is to fill up, is the primary function of Majja Dhatu. Garbhodpadascha, which is the making of the fetus, is the primary function of Shukra Dhatu. Avashtambah Purishasya Mutrasya Kledavahanam Svedasya Kleda Vidriti Vriddhastu Kurute Nila Karsha Karsnyoshna Kamitva Kampanahasya Kritgrahan Bala Nidrendriya Bramsha Pralapa Brahmadinata. The first half before Vriddhastu Kurute Nila means Avashtambah means to give support. Purishasya is fecal matter. So this literally means fecal matter provides support. Mutra or urine maintains the moisture in the skin. Svedasya Svedasya Kleda Vidriti means Svedasya Kesha Vidriti means Sveda supports the hair. There is also a Pata Veda which is Svedasya Kleda Vidriti. That means Sveda maintains moisture. Both of these are correct. Vriddhastu Kurte Nila means increased Vata. Karshya means emaciation. Karshnya, which means your skin will become dark. Ushna Kamitva means desire for heat. Kampa means tremor. Anaha means bloating. Shakrit Grahan means constipation. The word is Bala Nidrendriya Bramsha, but it can be split as Balahani, weakness, Nidrahani, loss of sleep, and Indriya Bramsha, which is loss of perception through sense organs. Pralapa, which is incoherent talk or blabbering. Brahma means giddiness, and Deenata means great misery. Pita Vinmutra Netratva Kshutrid Dahalpa Nidrata Pittam. Pitta, when increased, causes yellow, wit, fecal matter, mutra, urine, netra, eyes, and twak, skin, excess hunger and excess thirst, daha, burning sensation, and alpanidrata means reduced sleep. Shleshmagnisadana prasekalesya gauravam Praitya Shaitya Shlathangatvam Swasa Kasati Nidrata. This means Shleshma, when increased, causes Agni Sadhana, weak digestion because the Jataragni will go down.
Praseka, increase saliva. Alasya, laziness. Gauravam, heaviness. Shvaitya, pallor. Shvaitya, cold. No, Shaitya, coldness. Shvasa, breathing difficulties. Kasa, cough. And Ati Nidrita, excessive sleep. Rasopisleshbhavat raktam. Rasopisleshbhavat. This means rasa, the whatever happens when rasa is increased, the same happens when sleshma is increased. Raktam visarpapliha vidradin kushta vatasra pittasra gulmo pakushakamala vyangagninasha sammoha raktattvang netramutrata. Rakta, when increase, causes visarpa or cellulitis. Pliha vidradi, pliha, which is swelling of the spleen. Vidradhi, which is boils filled with pus. Kushta, skin diseases. Vatasra is skin diseases. No, diseases in Rakta related with Vata. And Pittasra, Rakta Pitta. Gulma, Gulmopakusha Kamala is the word, but can be split into Gulma, Upakusha, and Kamala. It means I don't know.
अस्तु समीचीनम् अभवत् खलु अस्तु You told it, sir. Pittam Paktushpa Paktushpa means what?
It's divided actually. Pittam,
Hmm.
Pakti means cooking, but since when the food goes inside, it transforms, and when you cook also, the food becomes different. So Pakti can also be called digestion. So Pittam,
Digestion.
Pakti, then Ushma is different, that is heat.
There is one more is there, no? Related with Vata. Akshanam Patavena cha.
Yeah.
Dhatunam Akshanam Patavena cha.
Yeah.
Yeah. What do you mean by the Patavena cha?
Sense organs.
They use already Akshanam.
Akshanam is
That is sense organ. Patavena cha.
Patavena means Patavena means proper. Patavena means proper functions.
Proper functioning. There is no any obstructions. Okay. While saying the Purusha, Mala, Avastambaha Purishasya. What do you mean with Avastambaha?
It supports or holds.
Holds.
Supports.
What to hold? What to support?
It
it holds or supports the body. So like let's
Also
say
supports the.
for example you've not eaten for 2 days.
Hmm.
It'll the purisha will kind of help to help you stay.
चलो मूत्रस्य क्लेदवाहनम उसका मीनिंग दैट मीनिंग
It helps
क्लेदवाहनम
it maintains the moisture.
it maintains the moisture. Then it should be in kledam stapayati, not vahanam. Kleda vahanam.
It removes moisture. It carries carries moisture.
It should be in vahana. Kleda vahana. Vahana they told, na?
It carries moisture.
Then Svedasya kleda vidrutihi means
Svedasya kleda vidriti means it removes. No, it maintains the moisture.
okay. अस्तु धन्यवादः.
तो एकवारं श्लोकं श्रावयति वा?
Everything or only sorry.
Only one श्लोक.
दोषधातुमलामूलं सदा देहस्य तं चल उत्साहोच्छ्वास निश्वास चेष्टा वेग प्रवर्तने सम्यग् गत्या च धातूनाम् अक्षानां पाटवेन च अनुगृह्णात्य विकृत.
Next.
पित्तं पक्त्यूष्मदर्शने क्षुत्रिडृचिप्रभा मेधाधीशौर्यतनुमार्दवै श्लेष्मास्तिरत्वस्निग्धत्व सन्धिबन्धक्षमादिभिः प्रीणनं जीवनं लेपस्नेहो धारणपूरणे गर्भोत्पादश्च धातूनां श्रेष्ठं कर्मक्रमात् स्मृतम् अवष्टम्भः पुरीशस्य मूत्रस्य क्लेदवाहनं स्वेदस्य क्लेदविधृति वृद्धस्तु कुरुते निलः कार्ष्यकार्ष्ण्युष्णकामित्व कम्पानाहस्य कृद्ग्रहान् बलनिद्रेन्द्रियभ्रंश प्रलाप भ्रमदीनता पीतविन्मूत्रनेत्रत्वक्षुत्रिदाहाल्पनिद्रताः पित्तं श्लेष्माग्निसदनप्रसेकालस्य गौरवं श्वैत्यशैत्यश्लथाङ्गत्वं श्वासकासातिनिद्रता रसोऽपि श्लेष्मवत् विसर्पप्लीह विद्रदीन् कुष्ठवातास्रपित्तास्र गुल्मोपकुशकामला व्यङ्गाग्निनाश सम्मोह रक्तत्वं नेत्रमूत्रता मांसं गण्डार्बुदग्रन्थि गण्डोरुदरवृद्धिता कण्ठादिष्वदि मांसं च तद्वन्मेधस्तताश्रमम् अल्पेऽपि चेष्टिते श्वासं स्फिक्स्तनोदरलम्बनम्
Okay.
अस्त्यदन्तांश
Atenidrata, mutrata. In these words, which pratyaya is there?
which? Can you repeat?
Pratyaya.
Can you repeat once again? It's not very clear.
In atinidrata and mutrata, in these words, which pratyaya is there? Atinidrata.
I didn't learn this.
Okay. Okay. Thank you. Dhanyawad.
Namaste.
ಧನ್ಯವಾದ ಭರತ್ ಕುಮಾರ್. The next participant is Danishka.
Namaskaram. My name is Danishka. I'm going to. My name is Danishka. I'm going to speak from the 11th chapter of Ashtanga Hridayam Sutrasthana, Doshadi Vijnaniyam Adhyayam. My topic is formations of dhatus, ojas, and summary of the chapter. स्वस्थानस्थस्य कायाग्नेरंशा धातुषु संश्रिता तेषां सादाति दीप्तिभ्यां धातुवृद्धिक्षयोद्भव पूर्वो धातुः परं कुर्यात् वृद्धक्षीणश्च तद्विधम्. Meaning, the Kaya Agni, which is the digestive fire, is located in all the dhatus, and if the Kaya Agni increases, then the dhatu will decrease, and if the Kaya Agni decreases, then the dhatu will increase. Purvo dhatu param kuryat vridhakshinascha tadvidam. It means if the previous dhatu gets imbalanced, then the next dhatu also will get imbalanced. The next dhatu will also get imbalanced. Dosha dushta rase dhatun दूषयन्त्युभये मलान् अधो द्वे सप्त शिरसि खानि स्वेदवहानि च मलामलायनानि स्युर्यथा स्वं तेष्वतो गदा. Meaning, if you have the wrong kind of taste and the doshas get imbalanced, increased or decreased, then it will imbalance the dhatus. The doshas and dhatus will imbalance the malas, and if the malas get imbalanced, then they will cause infections at the malayanas. ओजस्तु तेजो धातूनां शुक्रान्तानां परं स्मृतं हृदयस्थमपि व्यापि देहस्थितिनिबन्धनं स्निग्धं सोमात्मकं शुद्धं ईशल्लोहितपीतकं यन्नाशे नियतं नाशो यस्मिन् तिष्ठति तिष्ठति निष्पद्यन्ते यतो भावा विविधा देहसंश्रयाः. Meaning, ojas is the fine essence of the dhatus. It comes after all the dhatus, and it's mainly located in the heart, but it's all over the body, and it maintains the body. Snigdham somatmak. Snigdham means oiliness. Churnadi pindi bhava, which is like the quality to bind. Somatmakam is cool. Shuddham Isha Lohita Petakam. The ojas is pure, but it has slightly reddish and yellowish. If the ojas gets destroyed, then the body will also get destroyed. And if the ojas is with you, like it is there, then the body will also stay. Nishpadhyante yato bhava vividha deha samshaya. It's the ojas is there, is present in all the aspects of the body. ओजक्षीयेत कोपक्षुध्यानशोकश्रमादिभिः बिभेति दुर्बलो भीक्ष्णं ध्यायति व्यथितेन्द्रिय दुर्मना दुच्छायो दुर्मना रुक्षो भवेत् क्षामश्च तत्क्षये. जीवनीयौषधक्षीररसाध्यास्तत्र भेषजम् ओजो वृद्धो हि देहस्य तुष्टिपुष्टिबलोदय. Ojas reduces because of anger, excessive hunger, excessive thoughts, grief, and exhaustion. When ojas is reduced, there will be phobias, fear, weakness, a lot of thoughts. Vyatitendriya. The the sensory organs won't work properly. The chaya means the aura of the body won't be there. Durmana means confusion, dryness. All of this will come, and grief will come if the ojas is reduced. And to make it increased, you need to give them milk or meat soup. If the ojas is increased, then it will give you happiness, nourishment, and bala. Strength. यदन्नं द्वेष्टि यदपि प्रार्थयेता विरोधितो तत्त्यजन् समश्नंश्च तौ वृद्धिक्षयोज्जयेत्. Whatever food you don't like, you should avoid that. Whatever food you like, you should have, but that doesn't mean it should be unhealthy. It should be good for your body too. Kurvate hi ruchim dosha viparita samanayo vridha kshaye vridhakshaya vridhakshena bhuyishtam lakshayantya bodhanatat. Meaning, if the doshas get increased, then the gunas will also increase, and if the doshas decrease, the gunas will sorry.
अत्र पश्यतु अनुगृह्णात् विकृताः. What do you mean by the अनुगृह्णाति in what?
It's not clear, Jeshta.
अत्र पश्यतु अनुगृह्णात् विकृताः इति अस्ति स्वातस्य. स्वातदोषः करोति तं चलाः उत्साहनिष्ठासनिष्ठासचेष्टावेगप्रवर्तनैः इति अस्ति.
And I can't hear.
Is it audible?
I mean,
now it's clear, no?
To somewhat.
Anugruhnati means what?
Anugruhnati. What do you mean by that word? Anugruhnati.
It gives.
Yeah. श्लेष्मा स्थिरत्व सिद्धत्व संधिबंध क्षयादिभिः समाधिभिः.
Anna, can you repeat?
In the श्लेष्मा प्राकृत कर्म तत्वलिंग ना स्थिरत्व स्निग्धत्व संधिबंध समाधिभिः.
Yeah.
What the meaning of the क्षमा?
Shama means patience.
क्षमा means patience.
Anna, can you repeat?
क्षमा means what?
Kshama,
समाधिभिः.
Kshama means patience or forbearance.
Correct.
Ramachandra, sir, do you have any questions?
You said kuryat. Which
Yes.
dhatu is that? Kuryat.
Which?
Kuryat. Which dhatu?
Kr.
Kru dhatu. And which lakara rupa will be kuryat?
Vikri. Vidhi. Vitli.
Which?
Vitli.
Kru dhatu. In which lakara rupa will be kuryat? Kuryat.
Vidhiling.
Vidhiling.
Yeah.
Okay. And which vachana? Ekavachana or bahuvachana?
Ekavachana.
Ekavachana. In lat lakara? Kru dhatu in lat lakara?
Karoti.
Karoti. अस्तु सम्यक् धन्यवादः.
Thank you, sir.
Then
Are there any other questions?
धन्यवादः.
Thank you so much, Danishka.
धन्यवादः.
The next participant is Divya R. Bharadwaj.
Namaskaram. My name is Divya. I am from Sadguru Gurukulam Samskriti, and I'm going to present a small part of Sutrasthana Ashtanga Hridayam, 11th chapter Doshadi Vijnaniyam. And the part is going to talk about treatment. तत्रास्थनिस्थितो वायुः पित्तं तु स्वेदरक्तयो श्लेष्माशेषेषु तेनैषामाश्रयाश्रयिणामिथ. So this sloka means Vata is situated in Asti, and Pitta is situated in Sweda and Rakta. Shleshma is situated in the rest of the Dhatus and Malas. So because of this relationship, they're called Ashraya and Ashrayi. Yadekasya tadanyasya vardhanakshapanaushadham. If you give medicine to increase one, the Ashraya and Ashrayi of it will also increase. Asthimarutayornaivam प्रायो वृद्धिर्हितर्पणात् श्लेष्मणानुगता तस्मात् संक्षयस्तद्विपर्ययात् वायुनानुगतोऽस्माच्च वृद्धिक्षयसमुद्भवान्
विकारान् साधयेत् शीघ्रं क्रमालङ्घनबृंहणै वायोरन्यत्र तज्जांस्तु तैरेवोत्क्रमयोजितै. But this shloka's meaning is Asthi and Maruta are not like that. Mostly increase will happen due to kapha, because increase will happen due to nourishment. So because it's nourishment, kapha is involved, and decrease will happen due to reductive therapy, so vata is involved. So the diseases caused by increase and decrease should be treated with langana, which is light, and brahmana, which is heavy. But except for vayu, you should use the same method but in the opposite order. Usually for decrease, they will give brahmana, and for increase they will give langana. But for vayu, if it's increased, you should give brahmana, and if it's decreased, you should give langana. विशेषाद् रक्तवृद्ध्युक्तान् रक्तश्रुति विरेचनै. Especially for rakta vriddhi, you should do rakta shruti, which is bloodletting, and virechana, which is making them go to diarrhea. मांसवृद्धि भवान् रोगान् शस्त्रक्षाराग्निकर्मभिः. For mamsavriddhi, the disease is caused by mamsavriddhi, you should do shastra, which is surgery, kshara, which is putting a powder. It will cause some irritation and remove it. And agni karma bhi is heat therapy. स्थौल्यकार्ष्योपचारेण मेदोजान. So for diseases due to fat and thin, they are mentioned in the 14th chapter, and this happens due to increase and decrease of medas. Asthi samkshaya jatan kshira ghritairstikta samyutairvasthibistatha. For asthi decrease, you should give milk and ghee mixed with processed with bitter herbs. Vidvriddhi janati sarakriyaya vikshayodbhishak. If your mala increases, you should follow the same method as diarrhea. If your mala, can I repeat this shloka? Vidvriddhi janati sarakriyaya vikshayodbhishak meshajamadhya kulmashayavamashadvayadibhi. So if your mala decreases, increases, you should follow the same method as diarrhea. If your mala decreases, you should give the middle part of sheep and goat, and you should consume it. This is if you're a non-vegetarian. If you're a vegetarian, you should have porridge, which is made out of barley, and you should have masha dvayadibhi, which is masha is black gram, and raja masha is a different type of black gram. Mutra vriddhi kshayoktamscha meha kritra chikitsaya. If your mutra increases, you have to follow the method prameha, if it's decreased, you should do mutra kritra. The meaning of prameha is diabetes. From those diseases, I mean, you should follow the same method as diabetes. And mutra kritra is difficulty to pass urine. So there's a method, you can follow that. व्यायामाभ्यञ्जन स्वेद मध्यै स्वेदक्षयोद्भवान्. So if your sweda decreases, you should do exercises, which is vyaya, and abhyanjana, which is oil massage, and sweda is making, like, produce. You should do something to make sweat. You should do something to make yourself sweat. And drink, and you can consume alcohol. Namaskaram. I'm done with my presentation.
Yeah, अस्तु. अत्र यदेकस्य तदन्यत्र वर्धनक्षपणौषधम् अस्ति खलु. विवरणं करोतु तत्.
So if you give medicine, example, you give medicine to increase pitta, it will for example, I give medicine to increase pitta, it will also increase sweda and rakta.
Samichinam.
Anna, can you speak in English?
Yeah. Okay. वायोरन्यत्र तज्जास्तु तैरेवोत्क्रमोजितैः. Explain this one with padavibhaga and find the kriya pada, then anvaya.
Vayuhu anyatra tajjamstu tai reva utkrama yojitai.
Yojitai. Which one is the kriya pada?
Yojitai.
Yojitai. Correct. Which one yojitai? Ka or kim yojitai? योजितैः अस्ति खलु. किं योजितैः अथवा का योजितैः?
You should use the opposite method.
अस्तु, समीचीनं. धन्यवादः.
धन्यवादः.
Ramachandran sir, do you have a question?
Can you explain the Vyakarana Vaishishtya, what you can find in the shloka which you have taken for presentation?
Can you repeat the question?
You can select the Vyakarana Vaishishtya among the shloka which you have presented today. Can you explain what all Vyakarana Vaishishtya you could find in the shlokas you covered? Sandhi, which sandhis you can find if you want to make samasa? What samasa?
I don't know. No.
ठीक. Fine. Thank you. The next presenter.
नमस्कार. धन्यवादः.
Dhanyawada, Gugan. The next presenter is Durga.
Namaskaram. My name is Durga. I am from Sadguru Gurukulam Samskriti. Today I am going to be presenting about treatment and Ashraya from the 11th chapter Doshadi Vijnaniyam. तत्रास्थनिस्थितो वायुः पित्तं तु स्वेदरक्तयोः श्लेष्माशेषेषु तेनैषामाश्रयाश्रयिणामित यदेकस्य तदन्यस्य वर्धनक्षपणौषधम्. Vata and Asti are related to each other. Pitta, Sweda and Rakta are related to each other. Kapha is related to all the other dhatus and malas. This relationship, because this relationship can't be separated, if you give any medicine to one factor, it will affect the other factor also. अस्ति मारुतयोर्नैवं प्रायो वृद्धिर्हितर्पणात् श्लेष्मानानुगता तस्मात् संक्षयस्तद्विपर्ययात् वायुनानुगतोऽस्मात् च वृद्धिक्षयसमुद्भवान् विकारान् साधयेत् शीघ्रं क्रमालङ्घनब्रह्मणे वायोरन्यत्र तज्जांस्तु तैरेवोत्क्रमयोजितै. Asti and Maruta, but for Asti and Maruta it's not like that. For them, for Asti and Maruta, it's not like that. Mostly increase will happen due to nourishment. Because it's nourishment, kapha is involved. Decrease will happen due to reductive therapy. That means vata is also involved in this. Diseases caused by increase and decreased should be treated with Langana and Brahmana, heavy and light and heavy, sorry. But for Vata, you should treat it in the opposite way. When Vata is increased, you should treat Brahmana, heavy, but when Vata is decreased, you should treat Langana, light. विशेषाद्रक्तवृद्ध्युक्तान् रक्तश्रुतिविरेचनै मांसवृद्धिभवान् रोगान् शस्त्रक्षाराग्निकर्मभिः. When rakta is increased, when mamsa is increased, you should you can either do a surgery or apply a powder which will make it burn off, or you can put a hot metal so that it will burn off. स्थौल्यकार्योपचारेण मेदो जानस्ति संक्षया जातान् क्षीरघृतैस्तिक्तसंयुक्तैर्वस्तिभिस्तथा. When medas is increased or decreased, if you want to know more about it, you can check in the 14th chapter. When asti is in when asti is increased, you should give them ghee and milk processed with bitter stuff. विद्वृद्धि जानति सारा क्रियया विक्षयोद्भवान्.
अत्र क्षारः इति शब्दस्य अर्थः कः?
Anna, I can't understand. Can you speak in Sanskritam? English.
Samichinam. Kshara word you have used 2 times. Kshara shabda you have used. Understood? So can you tell the meaning of the word kshara?
Porridge. Sorry, Anna. Powder. It's a powder.
Powder. Did you read the Tika commentary on that particular verse?
No.
You haven't. Achha. Okay. Can you tell dhatu rupa of kshara shabda?
Anna, I don't know.
Okay. Arvind sir.
अस्तु महोदय उक्तवन्तः खलु धातुः किं करोति शरीरे धारणकर्म करोति.
Can you speak in English?
Dhatus are doing in a dhana karma. Similarly, balas are kim karoti.
I can't understand.
Dhatus are doing in a dharana karma. Similarly, malas are doing which karma?
They're letting it out.
Letting it out what?
They're letting waste out.
अस्तु अग्रे गच्छामः. अस्तु धन्यवादः.
What is definition of the term mala?
Waste.
No. Definition means you must tell in Sanskrit the shloka only. Yatha dushayanti iti doshaha dharanat dhatavaha.
Anna, I don't know this shloka.
Okay. Fine. Good. Next presenter.
Dhanyavadaha.
ಧನ್ಯವಾದ.
Namaskaram.
ನಮಸ್ತೆ ನಮಸ್ತೆ.
ಧನ್ಯವಾದ ದುರ್ಗಾ. The next presenter is Niranjan.
Namaskaram. My name is Niranjan. I'm going to present Doshadi Vijnaniyam, 11th chapter, Kshaya Lakshana of Dosha Dhatu and Mada. Lingam Kshine Nilengasya Sadolpam Bhashite Hitam Samyanashastatha Shleshma Vridyukta Maya Sambhava Pitte Mandona Lashitam Prabhahani Kaphe Brahma Shleshma Shayanam Shunyatvam Shudrava Shlatha. When water decreases, it causes weakness in the limbs. They talk less and do activity less. They'll be unconscious, and the shleshma with the symptoms will happen. When pitta decreases, it causes the digestive fire will be weak. They'll feel cold, and their aura will be less. When shleshma decreases, they'll feel giddiness. The places where shleshma is there they'll feel empty, and they'll have palpitation, and their joints will pain. रसे श्रम शोषो ग्लानि शब्दा सहिष्णुता रक्तें रशिशिरप्रीति शिरा शैथिल्यरूक्षता मांसे क्षग्लानि गण्डस्फिक्षुष्कता सन्धिवेदना मेदसी स्वपनं कट्यः प्लिह्नो वृद्धिकृशाङ्गता अस्न्यस्तितो दशतनं दन्तकेशनखादिषु अस्नामज्जनिसौषर्यं भ्रमस्तिमिरदर्शनम् शुक्रे चिरात् प्रसिच्येत शुक्रं शोणितमेव वा तोदोत्यर्थं वृषणयोर्मेढ्रं धूमायतीव च. When rasa decreases, their skin will be dry, they'll feel tired, they'll be thinny and fatty, and they'll have discomfort with sound. When rakta decreases, they'll have desire for amla rasa and cold things. They'll have laxity of blood vessels and roughness in their body. When mamsa reduces, they'll have loss bulk in chest region and cheeks. When medas reduces, the hip region they'll feel numb, and the spleen will get swollen, and they'll become thinny, and their limbs will feel weak. The reduced asti, the bones will be weak. The danta, kesha, and nakha will fall down. When majja decreases, they'll have porous on their bones and dimness in their vision and dizziness. When shukra decreases, shukra will take time to come out, and blood might come out with shukra, and they'll have burning sensation in genital organs and burning sensation. पुरीशे वायुरन्त्राणि सशब्दो वेष्टयन्निव कुक्षौ भ्रमति यात्यूर्ध्वं पीडयन् भृशं मूत्रेऽल्पं मूत्रे यत्कृच्छ्राद्विवर्णं सहस्रमेव वा स्वेदे रोमच्युतिस्तब्धरोमता स्फुटनं त्वच मला मलानामतिसूक्ष्मानां दुर्लक्ष्यं लक्षयत् क्षयं स्वमलायनसंशोषतोदशोऽन्यत्वलाघवै. When Purisha decreases, the Vayu it will go around the stomach making sounds, and they feel like uh, as if the stomach is twisting, and the Vayu will move upwards making a pain. The chest region and their sides of the stomach will pain. When Mutra decreases, difficulty to pass the urine, and it will come with discoloration. When Sweda decreases, the body hair will fall, and the hair will be stiff and cracked. They'll have cracks on their skin. When the minute malas, when they decrease, where they come out from, they'll be where they come from. They'll feel empty, feel pain, and they'll shrink. Namaskaram. I'm done with my presentation.
अस्तु न प्रश्नः अस्ति
I'm done with my presentation.
Thank you, Niranjan. ಧನ್ಯವಾದ.
Alright.
Now we move to the next presenter, Nishani.
Namaskaram. My name is Nishani. I am from Sadguru Gurukulam Samskriti. Now I will be presenting the 11th chapter of Ashtanga Hridayam, Doshadi Vijnaniyam. In that, I will be presenting the Prakrita Avastha and Vriddhi Lakshana. दोषधातुमलामूलं सदा देहस्य तं चलः उत्साहोच्छ्वासनिश्वासचेष्टा वेगप्रवर्तनैः सम्यग् गत्या च धातूनाम् अक्षाणां पाटवेन च अनुगृह्णात्य विकृतः पित्तं पक्त्युष्मदर्शनैः क्षुत्रिदृचिप्रभामेधाधीशौर्यतनुमादवै श्लेष्मा स्थिरत्वस्निग्धत्व सन्धिबन्धक्षमादिभिः प्रीणनं जीवनं लेपस्नेहो धारणपूरणे गर्भोत्पादश्च धातूनां श्रेष्ठं कर्मक्रमात् स्मृतम् अवष्टम्भः पुरीशस्य मूत्रस्य क्लेदवाहनं स्वेदस्य क्लेदविधृति वृद्धस्तु कुरुते नीलः पार्श्वकाष्ण्योष्णकामित्वकम्पानाः शकृद्ग्रहान् बलनिद्रेन्द्रियभ्रंश प्रलापभ्रमदीनता हीतविन्मूत्रनेत्रत्व क्षुत्रिदाहाल्पनिद्रताः पित्तं श्लेष्माग्निसदनप्रसेकालस्य गौरवं श्वैत्यशैत्यश्लताङ्गत्वं श्वासकासातिनिद्रता रसोऽपि श्लेष्मवत् रक्तं विसर्पप्लीहविधृदीन् कुष्ठवातास्रपित्तास्रगुल्मोपकुशकामलः व्यङ्गाग्निनाशसम्मोहरक्तत्वं नेत्रमूत्रता मांसं गण्डार्बुदग्रन्थि गण्डोरुदरवृद्धिता कण्ठादिष्वदि मांसं च तद्वन्मेदस्तथाश्रमम् अल्पेऽपि चेष्टिते श्वासं स्फिक्स्तनोदरलम्बनम् अस्त्यद्यस्त्यदिदन्तांश्च
मज्जानेत्राङ्गगौरवं पर्वसु स्थूलमूलानि कुर्यात् कृच्छ्राण्यरूंषि च अतिस्त्रीकामतां वृद्धं शुक्रं शुक्राश्मरीमपि कुक्षावाद्मानमाटोपं गौरवं वेदनां चकृत् मूत्रं तु वस्ति निस्तोदं कृते पिक्तसंयतां स्वेदोतिस्वेददौर्गन्ध्यः कण्डुः एवं च लक्षयेत् दूषिकादीनपि मलां बाहुल्यगुरुतादिभिः. Now I will be telling the meanings. दोषधातु मला मूलं सदा देहस्य. Dosha, dhatu and mala are always the roots of our body. Tam chala. Chala means vata. Tam means that. In this case we are telling that as the body. So vata gives the body. Utsaha, enthusiasm. Uchvasa, exhalation. Nishvasa, inhalation. Cheshta, activity of the body, mind and speech. Vega pravartanaihi, it removes the urges from our body. Samyak gatya cha dhatunam, it takes care of the nourishment and function of the dhatus. Akshanam patavena cha, it takes care of the function of the sense organs. Pittam means pitta, bhakti means digestion, ushma heat, ushna kamitva heat, bhakti. The ushma heat, darshanaihi vision, shut hunger, trid thirst, ruchi taste, prabha aura, dhi medha intelligence, dhi to differentiate, shaurya bravery. Tanumadavahi has two meanings. Together it means softness of the body. Tanu separately means thin and madavahi means soft. Shleshma means kapha. Thiratva, stability. Snigdatva, oiliness. Tandibandha, holding the joints. Kshama, kshamadibihi, patience. Prenanam, nourishment. Jivanam, life. Sneho, lepa, overlap. Sneha, oiliness. Dharana, to support. Purane, to fill up. Garbhodpada means making of the fetus. Dhatunam Shreshtam Karma Kramatsmita means these are the major activities the dhatus do. Avashtamba Purishasya means fecal matter supports the body. Mutrasya Kledavahanam, urine removes the extra moisture from our body. Svedasya Kledavidriti, Sveda maintains the moisture in our body. Vriddhastu Kurute Nila means increased vata causes. Karshya, thin. Karshnya, black. Ushnakamitva, desire for heat. Kampa, tremor. Anaha, bloated stomach. Shakritgrahan, constipation. Bala Nidrendriya Bhramsha means loss of strength, loss of sleep, loss of sense organs. Pralapa, blabber. Bhrama, dizziness. Dheenata, great misery. Pita, yellow. Bit, mutra, netrata. Your fecal matter, urine and skin will be yellow in color. Kshut, excessive hunger. Trid, excessive thirst. Daha, burning sensation. Alpanidrata, reduced sleep. Shleshma, kapha. Agni sadhana, weakness in digestion. Praseka, excessive saliva. Alasya, laziness. Gauravam, heaviness. Shvaitya, pale. Shaitya, coldness. Shlatangatvam, limbs will become weak. Shwasa, disorders in the breathing. Kasa, cough. Atinidrata, excessive sleep. Rasopi Shleshmavat means rasa is similar to Shleshma. Raktam means blood. Visarpa, a disease which spreads fast over your body. Pliha, your spleen will be swollen. Vidridhin, a boil filled with pus, Kushta, skin diseases, Vatasra, a disease caused by Vata and Rakta, which causes pain and swellings in your body, Pittasra, a disease caused by Pitta and Rakta, which causes bleedings in the openings of your body, Gulma, swelling caused by Vata in the abdominal region, Upakusha, a disease in the gums which make the gum bleed, Kamala, a disease which makes the skin yellow, Vyanga, discoloration in the face, Agninasha, weakness in digestion, Samoha, fainting, Raktatwang Netra Mutrata, Twak, your skin, eyes, urine will be red in color, Mamsam means Mamsa Dhatu, Ganda, swelling in your throat, Arbuda, extra growth in the body, Granthi, nodule, Gandorudhara, your cheeks and your cheeks, your neck, Uru, thighs, Udara, stomach will become big. Kanthadishwadi mamsamcha. Kantha means throat, Adi means the upper palate and the tongue will have extra flesh. Tadvan Medas Tatashramam. Medas is similar to Mamsa, but there are also few more. Alpepi Cheshtite Shwasa means even when you do less activity, you will become breathless and very tired. Spikstanodara Lambanam, your buttocks, your chest and your stomach will be hanging. Astyadyastyati dantamscha. Asti means asti dhatu. Adyasti means increased extra bone growth in the body. Adya danta means extra. Adya dantamscha means extra teeth growth in the body. Extra teeth growth. Majja netra anga gauravam. Majja means majja dhatu. Netra anga gauravam. Your eyes and the limbs will become heavy. Parvasustula mulani kuryat krichranya rumshicha. A boil in the joints which has a big base and hard to treat. I'm done with my presentation.
अस्तु इतोपि न प्रश्नाः सन्ति अग्रे गच्छतु
Now, your voice is breaking.
There is no more questions from my side. We'll move forward for the next presentation.
Namaste.
Thank you very much. The next presenter is Pratik.
Namaskaram, my name is Pratik. I'll be presenting the formation of dhatus, ojas and the summary of the chapter. Swasthanastasya kayagne ramsha dhatu samshita tesham sadati diptibhyam dhatu vriddhikshayodbhava purvo dhatu param kuryat vriddha shinasya tadvidam. This means there is a kaya agni in all the dhatus, which is digestive fire. If that increases, the dhatu will decrease. If that decreases, the dhatu will increase. Whatever happens to the former dhatu will happen to the succeeding dhatu. Dosha dushta rasay dhatun dushayanti ubaye malan adodveshapta sirasi kani svedavahani cha mala malayanani syur yata swamteshvato ghada. This means when the doshas get imbalanced because of the improper usages of the tastes, they imbalance the dhatus. The doshas and dhatus imbalance the malas. The malas, when imbalanced, cause diseases in the Malayanas, which are 2 below, 7 in the head, and the skin pores. ओजस्तु तेजो धातूनां शुक्रान्तानां परं स्मृतं हृदयस्थमपि व्यापि देहस्थितिनिबन्धनं स्निग्धं सोमात्मकं शुद्धं मीशल्लोहितपीतकं यन्नाशे नियतं नाशो यस्मिन् तिष्ठति तिष्ठति निष्पद्यन्ते यतो भावा विविधा देहसंश्रया. This means ojas is the essence of all the dhatus and it comes after all the dhatus. It is it is located in the heart but present all over the body and it maintains it. It is oily, cool, pure and appears slightly reddish yellow. Various aspects of the body are originated from ojas. ओजक्षीयेत कोपक्षुध्यानशोकश्रमादिभिः बिभेति दुर्बलो भीक्ष्णं ध्यायति व्यतितेन्द्रिय दुच्चायो दुर्मना रुक्षो भवेत् क्षामस्ततच्छये जीवनी औषधक्षीररसाध्यास्तत्र भेषजम् ओजो वृद्धौ हि देहस्य तुष्टिपुष्टिबलोदया. Anger, hunger, constant thinking, grief, and exhaustion cause ojas to decrease. When ojas decreases, it leads to phobias, weakness, constant thinking, sensory disturbances, loss of complexion, confusion, dryness, and to treat ojakshaya, you should give Jeevani Aushadha, which is something that nourishes the body. It is mentioned in the 15th chapter. When ojas increases, it causes tushti, pushti and bala, which is happiness, nourishment and strength. Yadannam dveshti yadapi pratayeta virodhitu tattatyajan samashnamscha dhatu vriddhikshayodbhava kurvatehi ruchim dosha viparitas samanaya dosha kshinascha bhuyishtam lakshayantyabhudanatat. This means you should treat the increase and decrease of the doshas by having the food that you like and not having the food that you don't like, provided that it is not contraindicated. The increase and decrease of the doshas will cause a desire for the opposite similar things, but the Buddha will not notice this. Yatha bhalam yatha swamcha dosha vriddha vitanvate rupani jahati kshina samasam karma kurvate. When the doshas increase, their gunas increase. When the doshas decrease, the gunas decrease. When the doshas are balanced, they do their work. येव देहस्य समाविवृधै तयेव दोषा विषमावदाय यस्मादतस्ते हितचर्यैव क्षयाद्विविधैर्धरक्षणीया. The same doshas which maintain your body, when imbalanced, can destroy your body. So you should maintain them by following a good lifestyle. I'm done with my presentation.
Arvind sir, do you have any questions? Arvind sir, are you there?
No questions? Next participant.
Namaste.
Thank you so much. The next participant is Tanvi. Now we have the last participant of this session.
How should I check this one? Namaskaram. My name is Tanvi. I'm going to present the 11th chapter of Doshadi Vijnaniyam. In Doshadi Vijnaniyam, I'm presenting the Prakshita Avastha and Vriddhi Lakshana. Dosha Dhatu Mala Moolam Sada Dehasya. Dosha Dhatu and Mala are always the roots of the body. Tam Chala Utsahochvasa Nishvasa Cheshta Vega Pravatane Samyak Gatya Cha Dhatunam Akshanam Patave Nacha Anugrinyata Vikrita Pittam Paktyukshma Dashane Kshutri Druchi Prabhameda Dishauryatanumadavaj Sleshma Stiratva Snigdatva Sandhi Bandakshama Preenanam Jivanam Lepa Sneho Dharana Purane Garbhodpadascha Dhatunam Aksha Shreshtam Karmakramasmritam Avashtambah Purishasya Mutrasya Vahanam Svedasya Kleda Vitrithi. Balanced state of Vata gives enthusiasm, exhalation, inhalation, actions of the body, mind and speech, the urges of the body, proper functions of the dhatus, and the proper functions of the sense organs. Balanced state of Pitta gives digestion, body heat, vision, hunger, thirst, taste, aura, memory, intellect, strength, softness of the body. Balanced state of Sleshma gives stability, lubrication, stability of the joints, and forbearance. Functions of dhatus: Preenanam, nourishment; Jivanam, life; Lepa, overlay; Sneha, unctuousness; Dharana, support; Purane, fill up; Garbhodpadascha, making up fetus; Shreshtam karma kramasmritam. These are the major functions which dhatus do. Avashtambah Purishasya. Purisha supports the body. Mutrasya Kleda Vahanam. Mutra removes the extra moisture from the body. Svedasya Kleda Vidriti. Sveda maintains the moisture. There's also Patabheda, which is Kesha Vidriti. It means Sveda supports the hair. Vriddhastu kurute nila Kashya Kashnoshna Kamitva Kampanaha Shakrit Grahan Bala Nidrendriya Bramsha Pralapa Brahmadinata Pita Vinmutra Netratva Kshutre Dahal Panitra Tapittam Sleshmagni Sadana Prase Kalasya Gauravam Shvaitya Shaitya Sladangatam Shwasa Kasati Nidrata.
increased state of Vata causes Kashya, thinness, Kashnya, dark discoloration, Ushnakatva, desire for heat, Kampa, tremor, Anaha, abdominal distension, Shakrit Grahan, constipation, Bala Nidra Bramsha, loss of sleep, Bala Indriya Bramsha, loss of sense organs, Pralapa, blabbering, Brahmadinata, dizziness, Brahmadinata, great misery. An increased state of Pitta causes Pitta, yellow, when fetus, urine, twag, netra will become yellow. You'll have excessive thirst and hunger and burning sensation, reduce sleep. Increase of Shleshma causes slow digestion, increased saliva, laziness, heaviness, paleness, cold, laxity of organs, breathing disorders, cough, excessive sleep. Rasopi Shleshmavat, Raktam Visarpa Pliha Vidratin, Kushta Vatasra Pittasra Gulmopa Kusha Kamala, Vyangagni Nasha Sammoha Raktak Twangnetra Mutrata, Mamsam Gandarbudha Granthi Gando Rudara Vriddita, Kanta Dishwadi Mamsamcha, Tadvan Medas Tatashramam. अल्पेऽपि चेष्टिते श्वासं स्पिक्स्तनोदरलम्बनम् अस्त्यध्यस्तति दन्तांश्च मज्जानेत्राङ्गगौरवम् पर्वसु स्थूलमूलानि कुर्यात् कृच्छ्राण्यरूंषि च अतिस्त्रीकामतां वृद्धं शुक्रं शुक्राश्मरीमपि. Increased Shleshma is same as increased kapha. Increased Rakta causes Visarpa, a disease which spreads all over the body fast. Pliha, spleen will get swollen. Vidradin, boils with pus. Kushta, skin disease. Vatasra, diseases which caused by imbalance Vata and Rakta. Pittasra, disease which is caused by imbalance Pitta and Rakta. Gulma, abdominal fullness. Upakusha, gum bleeding disease. Kamala, skin will become yellow. Vyanga, dark discoloration on the face. Agninasha, slow digestion. Sammoha, fainting. Raktak, Twangnetra, Mutrata. Urine, skin and eyes will become red. Mamsam, an increased state of mamsam will have causes ganda, diseases in the neck region. Arbuda, tumors. Granthi, lumps. Kanta, dishadi mamsamcha. Extra flesh in the neck region. Your thighs, cheeks and thighs, cheeks, and stomach will become big. Tadvan Medas Tatashramam means Medas also has the same as Mamsa. Also, it has Alpepi Cheshtite. Even if you walk less, you'll breathe fast and get tired easily. Spics, Tanodara Lambana, buttocks, chest region and stomach will hang. Asti is increased. Ati asti, extra bones. Ati danta, extra teeth. Majja is increased majja. Netra, eyes and limbs will become heavy. Parvasu sthula moolani kuryat kritranya romshicha. A boil which will have big base and it's hard to treat. Shukram Atistri Kamatam Vritam Shukram Shukrashmarimapi. Desire for woman and for a child, and in the bladder some stones will create. My presentation is over.
Judges, do you have any questions?
Done. Ramchandra sir, any more questions?
No questions, sir. Agree, Bachchan. प्रश्नाः न सन्ति मम.
ठीक. With this, yeah. Tell me, what do you want to tell?
Tell it in English.
Yeah. So with this, the Shastriya Samvada round 1 is concluded, and it was an marathon since morning till now to have conversation between Praudha Ayurveda Jnani and budding Ayurveda Jnani, and we feel honored and happy to witness such studies at this age, and which is witnessed only in one place, that is Sadguru's Gurukulam Sanskriti, and we are honored and feel very happy to be listening to all presentations since morning, and it was really amazing to showcase as a witness and to inform other Ayurveda scholars too, to learn how scholarly debate begins at the small age itself. Thank you all presenters for wonderful preparation of your studies. I know your vacation started, but still you all were made to wait and have this debate running in between, and you did a wonderful job for the Parishat. I am very, very thankful to all of you for patient listening and presence, and must be thankful to all the teachers who taught these kids about Ayurveda and the Samskrita Bhasha that made all of these to reach to this height. Very thankful to Gurukulam. Punah punah pranamam to Sadguru, who is carrying the legacy of Indian tradition with the name itself, that is Samskriti. And at the outset, I would like to render my salutations to both Ayurveda Tadvidya Vaidya who are involved, who spent a whole day of them with Shastriya Samvada, Dr. Arvind Kannoli sir and Madam Shilpashri Narayan, and Sanskrita Bhasha Parinita Upanyasaka Shri Ramachandra Joshi, who is assistant professor in the Department of Ayurveda, Samhita, Siddhanta and Samskrita, for patientful listening in spite of busy schedule and other personal activities. The only motto of all of us, you, we, and the panelists, is to witness true Ayurveda and bring back the legacy of Indian culture into its own fashion and way. With this aim and motto, we are moving ahead every day under the banner of Tadvidya Sambhasha Parishat Trust, and we are very, very happy to having collaboration with Isha Foundation since last 2 years. Thank you all for wonderful deliberations, discussions, and patience. The media from Isha Foundation also was managing the live sessions very properly, while the student exchanging their place, switching over, they kept a photocopy of Sadguru offering some flowers and leaves to Shishya. That is how Guru Shishya Parampara goes. I'm very thankful for keeping the monitor clean with positive vibes. All the media partners of Isha Foundation and Drishti, which is showcased over the Google Meet. Thank you all teachers, students, and our media partners. Of course, there was some technical issue in between, but they could address it at the earliest possible. Thank you all for keeping your day free for us, with us, and always. And I don't want to say bye now because would like to say hi again at the venue physically on 30th of April as a inaugural time of Tadvidya Sambhasha Parishat 2026. Signing off at present. Thank you all. The results will be announced very shortly in the social media as well as the group. Thank you very much. Namaste. Over to you, the organizers.
Thank you very much, sir, for addressing our valuable session. As we come to the closing end of this session, it fills all of us with immense pride and joy to witness the outstanding performance of the students of Isha Foundation in the Shastriya Samvada. Your dedication, discipline, and deep-rooted connection to our timeless traditions were truly powerful and inspiring. Shastriya Samvada is not merely about speaking. It's about igniting thought, expressing wisdom, and bringing Shastra to life with clarity and confidence. And each one of you did this with remarkable brilliance and grace. Your performance is not just excellence, it's a living reflection of rich tradition being revived with strength and purpose. It clearly shows the incredible foundation and guidance provided by your institution. Thank you for keeping the flame of our Shastras alive, for inspiring all of us, and for walking this path with such a passion and humility. Once again, heartfelt congratulations to all of you. Keep rising, keep shining, and keep inspiring. Thank you very much.
धन्यवादः.
It's a time to hand over the mic to both the panelists. First, I would like to call Shri Ramchandra Joshi sir to conclude with his remarks overall. Ramchandra sir. I request Arvind sir to conclude the remarks and then Ramchandra Joshi sir will.
Thank you, sir. This is a wonderful presentation conducted by Tadvidya Sambhasha. So that upcoming buds of the Ayurveda. I never expected, and it is unimaginable that this variety of Ayurveda teaching is also happens in the Gurukula. This is the first time I ever seen the students in such a way they have a good knowledge more than the teachers. Even I feel that I have to search and where it is there and how they are collected one, and how they are giving in answers in such a way that is unimaginable. I never heard a single word which is a wrong one during the presentations. Everyone has fully, thoroughly they prepared it nicely without having any hesitations, fear. They are saying one. This is the way we need in a Gurukula system, the study of Ayurveda. And this is a wonderful opportunity for me to get in this type of experience with the Gurukula system education. Thank you, sir. And thank you to the Isha Foundation. Thank you to all the organizers who are made this as a successful. Thank you. Thank you, Ananda.
Thank you, Arvind sir. I hand over and call upon Ramchandra Joshi sir to turn on mic and camera and address with the concluding remarks. Ramchandra sir. Sir, the light at the background is making your face dark. You can reface yourself. Ramchandra sir.
Yes, sir. श्रूयते. सर्वेभ्यः नमस्काराः. अस्मिन् शुभसन्दर्भे सर्वैः छात्रैः उत्तमरीत्या वाक्यार्थः प्रस्तुतः. अतः सर्वेभ्यः अभिनन्दनानि अस्मिन् सन्दर्भे अहं वक्तुमिच्छामि. एवञ्च आयोजकाः डॉक्टर सौरभ कोकट्नूर् महोदयाः, तेभ्यः अपि अहम् अभिनन्दनम् एवञ्च धन्यवादं समर्पयामि. अवकाशमपि प्रकल्पितवन्तः तेभ्यः अपि धन्यवादं समर्प्य मम वचनात् विरमामि. धन्यवादः.
Dhanyawad. Would like to know if anybody from Isha Foundation wants to speak up and give your opinion on this kind of events being organized. I don't know who is on the platform who will be speaking. Oh, Tejas, the senior student of Gurukulam. Right. Your mic is muted. No, the Google Meet mic is muted.
Namaskaram. Am I audible now?
Yes, yes.
Namaste, Mahodaya. I would like to thank you for the opportunity for all of the students. So I was also supporting them with the training of preparing for this. So in the last 2 months, it has been a great learning experience for all of them. On behalf of them, we would like to thank you for arranging this opportunity for them, and looking forward to doing more in the future. And also presenting during the actual Tadvidya Sambhasha Parishat, which is coming up in April. It has been a very deeply enriching experience for both the students as well as all of us teachers who have been supporting with them in their learning. I'd like to thank you once again. Namaskaram.
Thank you. Namaste, everyone, for being present at the scenario. We'll see all of you physically on 30th April morning at the venue. Thank you. Thank you very much. With this, we are concluding today's presentation, Shastriya Samvada for Gurukulam Isha Foundation students. And on 8th and 9th, the Shastriya Samvada for Vaidya Vidyarthi will begin. Over the same platform, it will be telecasted live. And I request the Gurukulam faculty members and senior authorities to make students listen and know that how Shastriya Samvada for Ayurveda learners continues. With this, I'm signing off. Thank you, one and all. I thank Swami Pranaka for being in constant touch with us and making this event happen very smoothly. Pranams to again to Sadguru feet and everyone at the Gurukulam. We hope one episode of Tadvidya Sambhasha Parishat will happen at Sadguru Gurukulam premises itself, so that the enrichment of Samskriti and Samskrita together will have a conglomeration and emulsion which comes out, and that can bring back the glory again. Thank you all. Namaste.